Welcome everyone to the Northeast Region Biofeedback Society webinar series. My name is Saul Rosenthal. I'm on the board of the NRBS. I'm a health psychologist up in the Boston area. And I'll be introducing our speaker today is Michael Holler. He's a licensed mental health counselor down in Florida. And he has certifications. Oops, I think somebody has their, there we go. Sorry, I was suddenly muted. He's the author of a newly released book, Structured Relationship Theory, and he'll be talking today about high conflict relationships, the role of trauma in keeping people stuck in those relationships, and how he integrates neurofeedback and bioregulation therapy into the work. Michael, welcome, and we look forward to your talk. And I'll be, if you have any questions, please put them into the chat. I'll be monitoring that, and we'll take about 10 or 15 minutes at the end to try to answer those questions. Michael?
Okay, I'm going to start real briefly and point out that Saul and I had an interview the other day that was on his blog, and if you haven't heard that yet, we're going to talk about the term bonding to the trauma, which is a term that I kind of coined. I don't know if anybody else has used it. So we'll get to that shortly. All right. Okay, so this webinar is sponsored by Lenusys BioRegulation Therapy Technologies, and I'm working and interfacing with them and training with Dr. Gabor, the neuropathic doctor in Budapest, Hungary, that developed that system. So we'll be talking some more about that later, but I don't want to spend too much time on it now. And just briefly, I lost a little bit of what Saul said in the beginning, so I'm not sure how much of it got muted. But as he said, you know, I'm a licensed mental health counselor in Florida. I'm a neurofeedback practitioner, and I'm also on the board of the Florida Mental Health Counselors Association, and I serve as the parliamentarian, and I'm a past president. And I'm the author of my book, little shameless plug here, Structured Relationship Theory, Nothing Less Would Have Sufficed, which is available on Amazon. And I'll talk briefly about that a little bit more, but I don't want to dwell on it too much. Okay, so the goals for today's session is that everybody here hopefully will be able to list and describe the pros and cons of talk therapy alone versus alternative methods such as neurofeedback and bioregulation therapy, which we're also calling electrotherapy. Or electronic therapy, and to utilize decision-making processes as to what approaches would be the best in any given treatment situation, that we would hopefully be able to explain to a client or a patient the pros and cons of utilizing these alternative methods as adjuncts to standard therapy, and explain the rationale of utilizing neurofeedback and or bioregulation therapy in working with relationships. Okay, so with regard to the applications of these, and here's where we're going to talk a little bit about that, you know, with the electromedicine, what I see with all of these is that each one of the processes that we utilize here are pieces of the puzzle. So it doesn't necessarily mean that one is better than the other. I integrate them all together and utilize whatever makes the most sense in that situation. And of course, as Saul pointed out to me in our conversation the other day, you have to pay attention to what your specific license or circumstantial or logistic processes are, or limitations that you might have. Little error there. My middle initial is G, not C, for Glenn. And then also collaboration and counseling with and coordination with counseling professionals. And that sounds a little oblique at first, but there are times I realize that some of you are neurofeedback providers and are not mental health counselors or psychologists or social workers or marriage and family therapists, but are mainly electromedicine practitioners. So some of you do neurofeedback standalone. Some of you, probably not as many, do bioregulation therapy. That's a fairly new process in the United States. It's very common in Europe now. And then there are people who, like me, who are therapists, and but we're not all under the same umbrella. I'm kind of a little bit of a Renaissance man in my situation. I'm in the Upper Key Largo area, the Upper Keys in Florida, and it's a small town. My wife calls it Hooterville with an ocean. So in a small town, a lot of times in a big city, and I discussed this with Saul the other day, I might be specializing in one thing. But in a small community like I live in, for example, I do a lot of forensic work. I do a lot of evaluations. I do family therapy. I do adolescent therapy. I do individual therapy. I do relationship therapy. And so I carry all these umbrellas, and I do the electromedicine. So some people are going to be more limited. So for example, if I were standalone neurofeedback provider or electromedicine provider, I might not be doing psychotherapy with people, but psychotherapists would then maybe refer to me, and we would want to work together to make sure that we're getting the best outcomes. But for example, if I were going to refer to somebody there have been times, for example, when I referred to Mike Cohen, who is in the Palm Beaches area, I believe, and he's more knowledgeable in neurofeedback than I am, or somebody moves up there, but that doesn't mean I can't still do psychotherapy with that person. So we have to coordinate with other people who are doing the various things that we may not be doing. And also, I threw this in here because the system that I use in neurofeedback, and I want to speak to this briefly before I get off this slide, is the brain paint system that was developed by Bill Scott out in LA. I don't consider myself to be a neurofeedback scholar, okay? And I'm not trained, for example, in doing QEEG. The brain paint system, and I'm not trying to sell it to you, but it's a very simple system, but it also has a diagnostic tool in it, which is basically a checklist and a charting process. But other people do a QEEG. But when I brought Bill Scott into the Florida Mental Health Counselors Association conference one year to be our keynote speaker, and I presented with him, sometimes what I was doing in the presentation was, because I think he's got an IQ of about 165, I could barely keep up with him, is I was kind of dumbing down what he was saying for everybody else. And one of the questions that inadvertently comes up for those of us who are clinicians is, can you build this on insurance? And the answer is probably no, not directly. Most of the insurance panels that I'm on have a CPT code for biofeedback, and then they have a price that they say they would pay for a biofeedback session, and they will deny it every time. But on the other hand, if I'm using this as part of my psychotherapy and it's simply a tool in a psychotherapy session, I don't believe that the insurance companies can tell me what tools I get to use any more than they can say, oh, no, you did hypnosis because you did a guided imagery in that session, therefore we won't pay for it. But I think it has to legitimately be a part of the psychotherapy before you could bill insurance for it, not stand alone. So keep that in mind. The other thing I think about my position here, and this is sort of where I'm presenting this today, is I stand in a way at a crossroads between psychotherapy and bioregulation therapy and neurofeedback, where I do all of these, but not necessarily all of them at once, although they can be mixed and mingled to a certain degree. All right, my button isn't working, so. All right. So application areas, neurofeedback and/or bioregulation therapy when working with relationships. And I just put down some of the ones that I've been exposed to. Bear in mind, for me, I know that neurofeedback has been around since the 70s, but I haven't been in practice that long. I've been in practice for 36 years, which is a pretty long time, but not that far back. But I've been doing neurofeedback for somewhere between 10 and 12 years. I'm not exactly sure how long. Bioregulation therapy, I've only been doing for about a year. It's a fairly new process in the United States, as I said. So these are some of the things that have occurred that I've been fairly successful in applying with. So just some examples for here of things that I run into. With utilization of neurofeedback when working with relationships, a lot of times, for example, I could use it with anxiety. There are two different types of anxiety, which is a product of my training. And there's left hemisphere anxiety, which tends to be very sequential and logistical and kind of like deductive reasoning. But also, I think, and this is my thinking, that because Wernicke and Broca's areas are in the left hemisphere, it tends to be very speech oriented. You'll see this a lot of times when people have kind of some obsessive or compulsive or both traits, For example, my wife has a little bit of OCD, and she calls it crosstalk, and that's where there's a lot of speech nagging at you with the obsessive part. You know, did we lock the door? I don't think we locked the door. Did we turn the stove off? We have to go back. We can't go on the trip. We have to go back and turn the stove off. What if they don't like me? What if I can't get my homework done? What if I don't say the right thing in the meeting? So left hemisphere anxiety has a lot of that verbiage to it. Okay, it tends to be naggy, for the lack of a better word. So left hemisphere anxiety works through these little phases. And anxiety on the left hemisphere tends to be the result of an under-aroused left hemisphere. So if I've got somebody that's got a lot of obsessive qualities, even if they don't have the compulsive things, and let me pause briefly here and define these words. My definition of obsession is a thought you cannot not think. My definition of compulsion is a behavior you cannot not do. Not all people who are obsessive have compulsions, like the rituals. So the person that is in the relationship that has that kind of naggy obsessive thing, what if my partner cheats on me? What if I can't be good enough for them? Then one of the things that I can utilize to help reduce that is to arouse their left hemisphere through a neurofeedback training. Depression also tends to live in the left frontal lobe, so I can also diminish that to a great degree by arousing the left hemisphere. And if I have a person in the relationship who has a history of trauma, then in neurofeedback, I can use the alpha theta protocol. And of course, those of you who do neurofeedback know that part of the beauty of that is they can work on their trauma without having to talk about it over and over and over again, as we might do, for example, in psychodynamic psychotherapy. Now, moving on to the utilization of bioregulation therapy when working with relationships, there's a little difference here. Anxiety, I still think of it as partially due to whichever hemisphere, and the right hemisphere would be more likely, the anxiety over there would be more likely the result of an over-aroused right hemisphere. But with bioregulation therapy, which is body biofeedback and pulsed electromagnetic field therapy, it works on the gut level. So it tends to work on the entire body, not just the brain. So there are things I think that it does that some of them are very simple, does better than neurofeedback is, for example, pain management. I've not had great success with pain management with neurofeedback, but bioregulation therapy is excellent for that. And so with anxiety, it's working on the entire body. And the concept being that the device that I use is called the CellCom. And also there are smaller devices I use in my own treatment and also with clients, or the Nesta, which is the smaller one. I'll show you that later. But the CellCom is a bigger device, and it's based on the idea that the cells communicate electrically, which we know they do, and both processes involve that concept. And so are they properly regulated? And the bioregulation therapy tends to take information from the body, it's at several different sites, and ask itself the proverbial question, are these regulating? Are they communicating? Are they doing what they're supposed to do? And if they're not, it uses fractal mathematics to analyze and examine those processes, and then feeds information back into the body electrically that gives the cells instructions as to how they should change. It tends to work really fast. I'll speak more about that shortly. So with anxiety, I'm working with the whole body to calm the central nervous system down. Now, I believe because the back pad that's behind their back is that when they're sitting in the chair is doing the pulse electromagnetic field therapy through the entire thorax, I think that it's tending to calm down and restructure the process of the vagus nerve. And of course, that vagus nerve is one of the biggest nerves in our body, and it has a tendency when when it's in its ventral position, it's regulating all the organs in that area: the heart, the lungs, the pancreas, the liver, the kidneys, the stomach, the gut, and the colon, and everything else in that area, a lot of which are detox organs. So they're supposed to be, if they're working properly, detoxifying the body. And we, of course, want them to work properly. And one of the things that we're finding is that the bioregulation therapy process tends to calm that whole system down very well and keep it in the ventral vagal. If you get stressed, like with anxiety or depression or trauma, then what happens is the vagus nerve goes into sympathetic nervous, which is the central circuit of it. It has three circuits: ventral, center, and dorsal. And once it does that, then the body goes into fight or flight. And of course, that's going to produce anxiety. And if we stay in that for too long, then it's going to produce depression. So with depression, with bioregulation therapy, we're working with the whole body to arouse positive affect, that sense of peacefulness. And I'll talk more about that with some case studies here later. And with trauma anxiety, I'm going to recommend that anybody who has not
We can't hear you. We still
Michael,
can't.
if you're able to hear us, we are unable to hear you.
The video is also not working.
Yeah, I think it was on his feed because everybody else is coming through clear. Just he's the only one that's froze up.
Mhm.
Yeah. He looks like he just dropped to rejoin.
Yeah, it looks like we lost the feed. So, yep, definitely have lost the feed. So we'll see if we can get that back.
Once he rejoins, he should regain the
Right.
host.
Right. Hold on in a few moments.
My apologies. I got disconnected and didn't know it for a while. Can everyone hear me at this point? I got yeses. Okay.
Yes.
And Saul or Turl or somebody, can you tell me where I went off the road?
You were describing the use of BRT. So I think you probably were about 30 seconds behind.
Okay, that's not so bad. Good.
Yeah.
Good. Okay. Let me get my screen shared here. No, that's not what I want to screen. Don't want that up.
Yeah, you left off it. I would encourage anyone to working with trauma and then disconnected.
I know exactly what I was saying. Okay, give me a second here. For some reason, slideshow. I need to do slideshow. Sorry, folks, bear with me. And that's slide sorter. I'm not really great with PowerPoint, so. I'm not finding my PowerPoint for some reason.
You can see it.
Oh, you can see it?
Yeah, you have it on presenter view.
All right, okay.
At the top where it says use slideshow, do you see that?
Hold on a second. Top where it says use slideshow. Oh, there it is. Okay. But I've got this weird thing up here. And get rid of that. Okay. And then I need to go back. get back where I was. Okay, here's where I was, I think. Okay, so what I was talking about was I was down at trauma anxiety. And one of the things that I was saying was that if you haven't read Stephen Porges' book, The Polyvagal Theory, that you probably should. There's a lot of really excellent information in that. And I think that can really help us out in electromedicine. And also, I would also recommend The Body Keeps the Score, Bessel van der Kolk. Both of those are great. And what I'm talking about here is when I'm working with relationships, the question that gets begged sometimes, and this is something I came across in my research as I was preparing for my book, was what happens when something happens in the relationship and I perceive my partner as a trauma? Because trauma is all about perception, okay? What's trauma for one person isn't traumatizing for another person. So it has to do with perceiving it. And I can remember, I was telling Saul the other day at a class in my undergraduate program where the teacher used to write his outlines for it that day, which was a great study guide. And he wrote, "Perception is an active, constructive process." And I was stopped in my tracks. So we have to, when we're working with people in relationships, be aware that we have to move into their space and be aware that their perception is what we're working with. Whether we think that they should be traumatized by this or not isn't important. The fact that they are traumatized is what's important. So what happens when I, for some reason, perceive my partner as a traumatizing trigger? And a good example of this would be if they had an affair. Let's make it simple, like a one-night stand, and the person can get locked onto that. And now I can perceive them as the source of my trauma, and then I can't move on. And so we may have to work with that. And bioregulation therapy is really good for that. And I think the alpha theta protocol in neurofeedback can really be helpful with that too. Now, a little bit of nuts and bolts here, and I'm going with my awareness of research, and there may be people out there who know some things that I don't know. Socrates once said that the wise person knows what they don't know. So that being acknowledged, when we look at talk therapy alone versus alternative methods such as neurofeedback or bioregulation therapy, so with the number of sessions and the length of a treatment plan, with neurofeedback, and I'll show you some research from Bill Scott here, and that's the only research I've got to access. Neurofeedback, the research shows it takes anywhere from 20 to 40 sessions to stick, okay? Very seldom, in my experience, do I get really huge, significant results very early in the process. Sometimes I do, but not a lot of times. And so that takes around 2 to 4 months for you to start getting significant results. We're talking, if you do it once a week, 10 to 12 sessions. If you do it twice a week, 8 to 10 sessions. With bioregulation therapy, and I was just talking to Gabor the other day about this, because you have certain protocols that you do, and we wanted to put a title on the big picture, all the protocols of the protocols. And so we decided to call that a regimen. So a regimen of protocols. With bioregulation therapy, we're on average taking 7 to 9 sessions, which go over 4 to 8 weeks. And they recommend doing it twice a week. Now, of course, most of us know that with neurofeedback, you have to do it at least once a week or it's not going to work. It's what I tell all my patients. But you can do it more times if you want. You just can't do it less. With talk therapy, it generally takes 20 to 40 sessions, which is over 5 to 10 months. And one of the objections, sales kind of, is people will say, well, if I'm going to do neurofeedback, it's going to take 20 to 40 sessions. Oh my God, what's that going to cost? Well, how many sessions do you think talk therapy is going to take? It's the same price. I charge the same for both, because an hour is an hour and it's a billable hour. The same with bioregulation therapy, but bioregulation therapy tends to work, in my experience, a lot faster. So the session duration is not that different. With neurofeedback, it's 40 to 60 minutes. With bioregulation therapy, it's 30 minutes to 60 minutes, depending on what you're working on. And with talk therapy, it's about 45 minutes, okay? Now, bioregulation therapy can be more than 60 minutes if you've got the time. I don't usually have that time because I'm billing on the hour. But talk therapy, we tend to keep it to 45 minutes. So the sessions vary, all right, in length. With client experience, what I'm seeing right now, and I'm not got what's the word? Evidence-based, lots and lots of data on this. I'd like to see it. But with bioregulation therapy, I'm starting to see immediate or quick results. Very often, not only in one session, but within 5 minutes. I've got, for example, a bipolar disorder protocol, and I put them on the system, and I start the system, and within 10 minutes, it takes them out of mania. Now, that's not 100%, but I've never seen results like that with bipolar disorder ever under any circumstances. So to have that person all of a sudden saying, my God, my mind is quiet. I've never seen that. With neurofeedback, it tends to take, in my experience, 8 to 10 sessions if it's twice a week, or 10 to 12 sessions if it's once a week, to see some significant improvement. With potential side effects, they're, with the electromedicine, they're pretty much negligible as long as you stay within good practice. You know, like, I mean, there are neurofeedback protocols I can do that'll cause people to drop things and fall down, but I wouldn't use those, obviously. So the side effects tend to be minor or negligible, and by and large, my experience with neurofeedback is any problem I can create with neurofeedback, I can get rid of with neurofeedback. And the most common one I've ever seen, which still isn't all that common, would be a headache. But of course, if I have a person on neurofeedback that gets a headache, I can do a T3, T4, or TC3, TC4, 12 to 15 hertz reward frequency and get rid of a migraine, much less a headache. So we can usually get rid of those kinds of problems. The other thing I see, little hint here for me, is with neurofeedback, sometimes they'll say, I think I'm getting a headache. And I'll ask them, is it pain or does it feel like pressure? And usually they say, well, it feels like pressure, it doesn't really hurt. And I think that's because the brain, when we're at rest, utilizes 80% of our energy. And so when we're working it really hard, such as in neurofeedback, it's calling for more blood and more alcohol, more blood and more oxygen. And since it's calling for more blood, it's expanding those blood vessels, and that creates a little bit of pressure. With bioregulation therapy, the symptoms are minor. They're basically negligible, if anything. The only side effect I've seen from bioregulation therapy is a mild headache afterwards, and that's almost always caused by not having them drink water before and after the session. Because, as I said earlier, with bioregulation therapy, it's working at the gut level, and it's causing all of those organs, the kidneys, the liver, the pancreas, you know, the gut, they're all detoxifying. And as the performance of those organs change, they're beginning to pull toxins out of the blood. And if you're pulling the toxins out, you need to flush them with water. And so if we have them drink a cup of water, and it doesn't have to be huge, you know, something that big, just to give you a size characteristic. And I always keep bottled water, or I mean, a big jug of filtered water in my waiting room. They drink a glass of water before and a glass of water after, then that tends not to happen. And with talk therapy, it can be variable. And this is something that I found, especially when you're working with trauma, to be an incredible tool. And I don't mean to sound like a bioregulation therapy commercial, but I'm just looking at all of the systems. I still use all three of these processes: neurofeedback, bioregulation therapy, and talk therapy. But I found I can take a person who is having a horrible PTSD, flashback, trauma reaction, and they're curled up on my couch and they can't tell me even in the first session what's happened to them. But if I put them on bioregulation therapy and do a very mild session with what we call foundation, which is something that we tend to start with, it's a very soft approach, but it tends to calm down that vagal response. And so they don't have the trauma response. They're able to tell me about this horrible stuff that happened to them. And not only does it keep them calm while they do it, but it makes them feel better at the end of the session. And I've done a lot of work with that over my experience. And I found, you know, usually takes 2 to 3 sessions before they're walking out of here not feeling worse than they walked in. But with bioregulation therapy, I can actually do a session while they're under the BRT. With neurofeedback, if I talk to them, it interferes with their performance. Whereas with bioregulation therapy, it doesn't seem to do that. Now, a little caveat here, as I said, I'm training with Dr. Gabor with regard to the system that he developed. And he said, you know, if you're talking to them during it, it may be hindering its performance, but you couldn't prove that by me. And I've spoken to him about that, and I'm sure we'll have more conversations about it. So with talk therapy, I'm not sure, and I'm pretty good at calming people down. I always have been, and everybody tells me I have the radio voice, and maybe that helps. I don't know, but whatever works, works. You know, you use what you've got. And with regard to the clinician technology learning curve, what I call the training runway length, you know, does getting started with this equipment have a long runway or a short runway to get up in the air and flying? With neurofeedback, I found it to be a pretty long runway. As I said, there are still some things I'm not very well trained in, and one of them is QEEG. But for example, in speaking to Bill Scott, I had a discussion with him when we were presenting together, and I said, why don't you use QEEG? Because I know he's highly trained in it. And he said, because I can do a QEEG on somebody in the morning and then do a QEEG on that same person in the afternoon, and they look like two completely different people. So what he said to me, and I'm not prepared to try to defend this, is show me the research that shows that that's necessary. Whereas if we have 4 clear measurable goals and we're measuring and logging their progress every time as they report it, that's pretty good progress. I mean, we at least know what's happening. With the bioregulation therapy, it seems to me to have a shorter runway to get started. And to be honest with you, because it was a very new thing, and it's something that I was very cautious and skeptical about approaching and getting into. And I know that I had a conversation with Tiffany, who works with Turol, about that. And she asked me, well, what was the biggest hindrance to getting started with this? And I said, the biggest hindrance was Michael Holler. I was kind of getting in my own way because I was scared. You know, is this really going to work? Am I comfortable with it? Do I have the amount of training? I'm also the ethics committee chair of the Florida Mental Health Counselors Association. And I know one of our ethical principles is we don't do things we're not trained to do. So I wanted that training. But, you know, as you're starting, it's kind of like a self-feeding circle in that you have to do it in order to get trained in it. So it's practicing. But the more I do it, the more transparent it seems, and the more I find myself having an easier time adapting to other protocols that I wasn't doing before. So I find my knowledge in it expanding way faster than my neurofeedback knowledge ever expanded. Now, that's my experience with it. I don't claim that that's researched, but that's been my experience. And I'm pretty comfortable with it now, and I've only been doing it for about a year. I still intend to do a lot more training just because I like to do that, but it just seems like it's easier to get the knowledge and get it under your belt and understand what you're doing. And therefore, I found it to be quicker. So that's my story, and I'm sticking to it on that one. Okay. Now, the other thing with regard to pros and cons with talk therapy, neurofeedback, bioregulation therapy, pros and cons is client program follow through. Of course, we want what we're doing to be self-motivating and self-reinforcing. With neurofeedback, I've had the experience that there is a lag in the results that are apparent to the client, and that can be demotivating. Now, obviously, that depends on what condition you're working on. I find, for example, working with neurofeedback on anxiety or depression is much more apparent. Those are painful. When those anxiety symptoms or depression symptoms go away, they feel the pain going away. But one thing I do a lot of work with, because I've been working with adolescents a lot and for 36 years, I was a musician in my first career, and everybody said, well, you were a band leader, so you're going to be great with those teenagers. And so they threw them at me. And it turned out I am good with them, because working with musicians was like we're trying to herd cats. And same with adolescents. I guess I'm a pretty good cat herder. But one of the things that I love about neurofeedback is that it's great for working with ADHD. But the difference is with things like depression and anxiety, the bad stuff goes away and it becomes apparent in its absence. But with neurofeedback, I mean, with ADHD, you're not taking away bad feelings, you're adding performance, and performance doesn't feel like anything. So I found that I need to really kind of, I really have to apply talk therapy as at least a small component of it. So for example, one symptom that I typically get in ADHD is because, the goals that we define, and that's one of the things that the brain paint is really hallmark classified is classic presentation is we want clear measurable goals. And a goal can be a problem that we want to not be happening anymore, or it can be a description of a problem that we want to improve. And one I hear in ADHD a lot is I can only read one page before I realize I've lost my place and I have to go back half a page and find my place. So let's say I get 8 to 10 sessions if I'm doing it weekly, maybe 10 to 12. And the person says, I don't think this is working. I don't feel any different. Well, them not feeling different is kind of good because we don't have any side effects that they can feel. That we like that. Okay. But I say, okay, you don't feel any different. So how many pages can you read now before you lose your place and have to go back half a page? They say, oh, about 10. Well, that's 1,000% improvement. But the only way we've got to measure that is not a QEEG. It's in their self-reported performance improvements. Okay. So if they've gone from 1 page and losing their place to 10 pages, we're kicking butt and taking names. We like that. Okay. Whereas on the other hand, with bioregulation therapy, the results are often quickly apparent to the client. Okay. What I a lot of times will start with when a person is feeling anxious is I'll put them on the device and I just do a foundation protocol. It can be 30 minutes. It can be 49, 60 minutes. But within about 5 to 10 minutes, they're like, well, I always ask them with your problem that you're experiencing right now, the anxiety, the feeling of depression, the agitation, put it on a scale 0 to 10, with 10 being the worst. And it doesn't have to be one symptom. It can be the cluster of symptoms that they're dealing with. I'm feeling depressed. I'm feeling anxious. I'm feeling restless. Okay, we'll put all of those, sum them 0 to 10, and they'll say, I don't know, 8 or maybe 5. I don't care what the number is. We're just going to keep track of the number. And then about 4 minutes in, I can usually see it on their face. I'll say, what's your number at? Well, it's at, it went from 8 to 4. Well, that's a 50% diminish in 4 minutes. Okay. By the end of the session, their number is down to 1 or 0. And a lot of the most common comment I hear from them is, I feel like I had a glass of wine. Now, not the drunk part, but the calm part. And that's something that I've never gotten with anything before, and I think I'm pretty good at psychotherapy. But even that, a lot of times clients are calmed down, but not that much, and not within 4 minutes. And I can also do a psychotherapy session while they're on that, as I've said before. So that's like golden. Now, the client/patient's experience with neurofeedback, it's a passive experience. They're just sitting there. There's nothing they can do. The part of their brain that's interacting with the equipment is below their conscious awareness. The part of their brain that's changing is below their conscious awareness. For the most part, they have no conscious ability to change that, with the exception of the high beta. High beta, we have some control over consciously, but most of the other frequencies we don't. With bioregulation therapy, it's also a passive experience. So with neurofeedback, it's rarely immediate results. With bioregulation therapy, it's frequently immediate results. And with talk therapy, it requires some effort from the client, which I don't think is a bad thing. And results are variable. But if they're variable, why not use a tool that increases the ability to make positive outcome possible? Because if we think about what our effect is, if I go to my physician, I can figure that I have about a 75% chance, and the research backs this up, of them actually concretely helping me. If I go to a psychotherapist, I have about a 75% chance of them helping me. If I go for neurofeedback, I have about a 75% chance of them helping me. Now, bioregulation therapy, I don't know the numbers on. My anecdotal experience is that's way over 75%, but it hasn't been researched yet. I'd love to see some double-blind studies on that. Okay, now these are some of the statistical results that I have accessible to me. These are straight out of Brain Paint, so these are self-reported results, okay, that Bill Scott has kept track of and researched. And I've known him for almost 10 years, and the man eats, sleeps, breathes, and dreams research, okay? And so if you look at the numbers here, they kind of make sense with, at least they make sense on ours. And these scales right here are overall of all issues, okay? And of course, the first thing I'm going to look at from my research education is I'm going to look at the sample size. And if you look in the upper corner there with the little blue dot, you'll see it says all clients and all issues, N equals 16,490. So that's almost 16,500 subjects. Okay, that's a huge sample size. And we always like to see a large sample. This is way beyond a large sample. This is like over the top. So what they're reporting is within 2 sessions, they have 45% improvement. Within 5 sessions, 63%. Within 10 sessions, 74%. And within 20 sessions, 80%. Now, I know there are many neurofeedback systems out there, some of which I'm somewhat familiar with. I was originally trained on the Eager system. I didn't really like that system. I always felt like I was feeling my way through the dark. I don't mean to badmouth them. That's just my experience. I know other people have worked with them very successfully. And I'm very familiar with brain paint because I've used it for years. I know there are other systems that are much more advanced than what was available at the time I got started. But I don't know the rates on the other systems, but I wouldn't be surprised if they're not within this same range, okay? But this is what I do know. Now, he's broken it down into specific areas, and you can see that it works, neurofeedback works pretty well with some areas and not so well with others. So he's broken it down here, and I have 2 pages of this. So the first little category there is motor tics, about a 33% improvement, okay? And this is overall, you know, where we're getting into the 20 to 40 sessions. With OCD, which I've had great luck with, 42%. I know of 4 people in my community who no longer have OCD because of the work I did with them. I'm not taking credit for that. That's the neurofeedback. We know that's their brain training itself. Mood swings, and the sample size is 9. He's got the sample size broken down here, okay, at the top. And mood swings, it's 48%, okay? With ADHD, it's 37%. My experience in working with ADHD is that I can rarely completely get rid of it, but I can usually significantly diminish it. And we know from what's out there that the American Academy of Pediatric Psychiatrists is now saying that neurofeedback is the #1 recommended treatment for ADHD. Medication is number 3. Number 2, cognitive behavioral therapy. I think that's a very overrated therapeutic process, and it's very, very easy to research, okay, because it's easy to operationalize. And psychosis, 71% success rate. That's huge for psychosis when you think about it. I know of one study, and it was a double-blind study that they did, and they had 48 people who were diagnosed with schizophrenia. They did 2 neurofeedback sessions a day with a 2-hour break in between. They did that for 30 days. And at the end of the time, there were 48% of the people in it no longer had any psychotic symptoms whatsoever, and that stuck. They basically cured their schizophrenia. If you looked at the higher number, which includes the 48%, 71 or 72% of them had clinically significant results. That includes that 48%. So it's really good with psychosis. It sounds crazy, but it is. With chronic pain, you notice that's pretty low, 33%. And that's something I've discussed with Bill, and he said, I've never had really great results with chronic pain. On the other hand, with neurofeedback, with BioRegulation therapy, I have great results with chronic pain. And we're talking immediate results. And then when you get into the next section, and you can see that this goes across time. So we got 2 sessions, 5 sessions, 10 sessions, and 20 sessions. So you can see, for example, with just going with motor tics, almost 100% of them got rid of them. Also with psychosis, 100%. Now, this is his experience, not mine, but still, this is pretty good stuff. And it's kind of validating to all of those of us who do neurofeedback. Even though with neurofeedback, you don't see very many double-blind studies either. I don't understand why, since it's been around since the 70s. Which is probably why insurance companies don't cover it. The insurance companies love to say no. they like to take in fees and deny claims. Okay, so with this is a second page of results, and it's marked the same way. So you see the sample size up above, and you see 2 sessions, 5 sessions, 10 and 20. So with 2 sessions, PTSD got a 55%, but when you get to 20 sessions, you get a 99%. I'm not going to spend a whole lot of time on this. Nightmares, insomnia. I don't know about you all, but I find that whether I'm working on sleep or not, neurofeedback tends to improve people's sleep. And another thing I've had really good luck with is significantly reducing PMS symptoms with neurofeedback. I have no clue why that works. Okay, but who cares? If it's working, if it ain't broke, don't fix it. Okay, and I don't know how I'm doing on time here, but I think I'm doing okay. Now,
sorry to interrupt. I want to answer.
No, that's okay. This is a good time.
If we want to have a little bit of time for questions, we have about 10 minutes left till the hour. So
all right. Well, let me zap through. For some reason I was thinking I had 2 hours, but ask me what time it is. I tell you how to make a watch. Let me get out of the. All right, so I'm going to, and there it is again. Sorry, I'm not good with this. Okay, so case studies. And I don't have to get through all my case studies, so that's not important. But I really want to talk about stuck, so I'm going to skip ahead to that. So this is the case studies and stuck. With ADHD, a lot of times when I have couples and one of them has ADHD and the other one doesn't understand it. And this was an 18-year-old female that I worked with. She had ADHD and anxiety and a history of a closed head injury. And the relationship with her parents was very strained. And when I did with neurofeedback for ADHD and anxiety, arousing the left hemisphere, and family therapy with the patient and her parents, I did neurofeedback with 12 sessions with no significant results. I was very disappointed in this. I was getting nowhere with her ADHD. I have an ADHD protocol on BioRegulation therapy, and I've done 6 sessions today, and it's significantly improved her ADHD symptom and reduced her anxiety symptoms. And in tandem with that, I got her parents in for a conversation and a few family sessions, and their relationship has improved significantly. Again, this one, 35 and 34-year-old hetero couple, wife has ADHD and OCD. The husband's very hostile and alienating. They split up, and now there's a lot of parental alienation going on, especially on the part of the father. The wife did bioregulation therapy to calm her moodiness and diminish mood swings. With neurofeedback, I had no significant results whatsoever for her ADHD or OCD, but with bioregulation therapy, after 6 sessions, a whole lot of improvement in her anxiety symptoms and some improvement in the ADHD. This one was huge. I had a 52-year-old female who had PTSD and depression. After 6 sessions, her trauma response is almost nothing. I just have never seen anything like that. Here's a 36 and 37-year-old hetero couple. Wife has anxiety and raging. I suspect she has a personality disorder, and this is a classic example of the bonding to the trauma. I want to talk about that concept. So I'm going to sort of end with this one and drop into the end section here and get some questions. But we all know what trauma bonding is, and that's where 2 people bond together in a situation that creates a trauma. And that trauma creates a state of arousal in the brain, and the brain can't tell the difference between states of arousal. So it may mistake the anxiety and bad associations with all of the traumatic things that are happening, like 2 people who are in a war zone who hate each other, but end up having to stay in a hiding spot and getting drunk, and they end up having sex with each other. And then in the next morning, they're like, what the heck did we do? They bond, that's trauma bonding. But bonding to the trauma would be, for example, if in this case, the husband had a one-night stand affair. He admitted it. He was willing to work on it. He wanted to fix the relationship. She said she wanted to fix the relationship, but she will not let go of that affair. It's like she's written it down in a little book, and she holds it in front of her, and she is bonded to the trauma more than she's bonded to her husband. And so when a person bonds to the trauma, they won't let go of the trauma. and it's almost as if they feel like if I've got this, I'm holding it in front of me, I can't see my partner through it. But if I let go of it, it could get around behind me and bite me in the butt. And so they just cling to that trauma. And I'm finding that the bioregulation therapy really helps with that. Whereas the neurofeedback, when I did some alpha theta, did nothing. It didn't help at all. So that bioregulation therapy really helped her quite a bit. And I couldn't even confront her because she was like, yeah, but the trauma, yeah, but the trauma. Okay. And we've talked a little bit about polyvagal theory, and I can't really get too much into that. Oh, this one's huge. I do want to mention this one. I have a 17-year-old female. She has bipolar disorder, and it's pretty severe. She has racing thoughts, grandiosity, mood swings, extreme depression, distractibility, social withdrawal, and on top of that, she's got OCD. With neurofeedback, I got nowhere with her. She was taking medication, which helped her quite a bit. At least, that she was doing Lamictal for the mood swings. But then the doctor decided to put her on Lexapro, which is an SSRI. And I don't know how many of you know this, but SSRIs, energizing antidepressants, tend to take bipolar people and send them into mania. And so she became extremely manic and showed up in my office just, her brain was on fire. Did one bioregulation therapy session, and her mania was significantly reduced, and then did 5 more sessions, and now it's 80% reduced. Her parents think I walk on water. So just really quickly at the end here, I think that we all use an collective thoughtful response in combining psychotherapy, psychoeducation, and electrotherapy, and that can be synergistic and very productive in reducing symptoms. And when the clients see significant results, it results in buy-in, and that helps them stay with the therapy. I find bioregulation therapy to be a very promising up-and-coming procedure with potentials on many fronts, and I've included the Lenusys information here so you can go to them, get a demonstration, find out for yourself what it is. Full disclosure, I don't make any money off of this. I'm not sales for them, okay? This has just been my experience of it. Okay, well, all right, so questions, comments, rude
Great.
remarks?
I'm sure there are plenty of those, but I'll try to edit them out a little bit.
Okay.
So we do have some questions. There were a number of questions about the BRT,
Okay.
which seems to be a combination of reading in physiologic systems and then kind of putting out pulsed electromagnetic field (PEMF).
By the way, you can also do neurofeedback or biofeedback inside that system.
Okay. There were some questions about what exactly it's reading, and then what are the frequencies, the PEMF frequencies? Is it based on what it reads? Does it sort of modulate the frequencies based on what it's reading from the body?
Okay, not being an electrical engineer, we're getting way over my pay grade here. I don't know exactly what it's reading. I know that it's reading the electrical activity and the communication between the cells.
Mm-hmm.
One of the things that it's been compared to me as being a musician, I think of it as sort of like a PA system. The person is the microphone, and the person is the speaker, and the device is the amplifier. So it takes in the electrical information from the body. And as far as I understand, as Dr. Gabor is explaining it to me, the mathematics that are happening in the electronics are fractal based, which means they're looking at everything on a 3-dimensional way. They're looking at the behavior of the cells from all angles. There's another great book that you might want to look at called, I believe it's called Currents. Hold on a second, I'm going to grab it real quick so I don't get it wrong. It's by Robert O. Becker, Cross Currents. Okay. That's another book, if you're really interested in this, that's worth reading. And it's kind of about the background and history of electromedicine. And he explains everything scientifically, but very simply. So I'm finding it a very enjoyable book to read. So those 3 books, I would say. So I can't explain to you other than that. Mm-hmm. And I'm not a mathematician. And so I understand basically how fractals work. And I know they're 3-dimensional. Well, more than 3-dimensional. Okay. And as Dr. Gabor, I said, well, now we're getting into quantum physics. He said, no. Quantum physics is like kindergarten compared to what we're doing here. But it's kind of proprietary. So I don't know that the man's ever going to tell me exactly what's in the device.
I think for people interested, Tiffany Mullen has put some information into the chat, and I think she's going to possibly send us some more information as well, which would be great.
Yeah, after the webinar, we'll send out some more information specifically around how the BRT works, the protocols that are included in the system that we're specifically talking about, which is the CellComm, and some of the ways that it communicates across the frequencies. To Michael's point, the device is essentially capturing via the things that are placed on the body and pulling it through the system. And there's signals within the system that take it as an input and then output, and it adjusts based on the modality that you've selected within the system itself. So happy to send some more information out afterwards to everybody.
Great, thank
And
you.
I'm not going to go into the question, Saul, but I see Michael Sitar asked a question. So what I did is I put my email into the chat box. So if anybody wants to email and ask questions, I'm happy to answer them.
Okay,
I'm going to put my website on here too.
terrific. And that
Can you
information-
email us that stuff, since I can't access chat through my phone at the moment?
Okay, we will, we'll make it available, and an email will go out with it. It's usually, the information is usually available within a week after the webinars, including a recording of the webinar.
Saul, are you able to capture or download out of Zoom the questions that are being asked, just so we can make sure that anyone that asks questions is able to kind of get a response from us?
Absolutely,
Yeah,
yeah,
we'll send those to you.
yeah.
Great.
And just
and-
real quick, my website is michaelholler.com, and you can email me through that. My email is mholler@terranova.net. So, but it's in the chat box, so it'll be in the recording too. So,
And there were a few other questions, but we are running up to the hour, so we should probably officially end this. Michael, thank you so much for joining us, and Lenesis for sponsoring the NRBS.
and I thank you all for inviting me. I feel overwhelmed, honored.
Appreciate it, Michael.